Hey everyone, it's E.Kess, and if you're watching this, chances are you've experienced the frustration of back pain at some point. It's incredibly common and can really impact your life. You go to the doctor, they tell you it's probably just a muscle strain, to take some pain meds and rest. But what if it's something more? In this video, I'm going to give you an insider's look at how doctors think about back pain and share 7 worrying signs that could indicate a more serious underlying condition. Remember, I'm not trying to alarm you, but knowledge is power. By understanding these signs, you can advocate for your health and seek appropriate medical attention if needed. The first thing we consider when evaluating back pain is the duration. Most cases of back pain are acute, lasting a few days to weeks. This type of pain is typically caused by muscle strains or sprains. If your back pain persists for more than 6 weeks, it's considered chronic. Chronic pain warrants further investigation. See your doctor to determine the cause and discuss treatment options. The second warning sign to watch out for is if your back pain is progressively getting worse. Now, it's normal for back pain to fluctuate in intensity throughout the day or even from day to day. However, if you notice a consistent trend of increasing pain, especially if it's not responding to typical at-home remedies like rest, ice, or over-the-counter pain relievers, this could be a red flag. Progressive back pain can indicate a number of underlying issues, including a worsening herniated disc, a spinal infection, or even certain types of cancer. Pay close attention to how your pain is changing over time. If it's steadily escalating, it's crucial to seek medical advice. The third red flag might seem a little out of left field, but trust me, it's important. If you're experiencing back pain accompanied by fever or night sweats, it's time to head straight to the doctor. Now, I know what you might be thinking. What does a fever have to do with my back? Well, fever is often a sign of infection. And while back infections are relatively rare, they can be serious. A spinal infection, also known as osteomyelitis or discitis, can occur when bacteria enter the bloodstream and travel to the spine. Night sweats can also be a sign of infection, as well as certain types of cancer, so never ignore this combination of symptoms. Chapter 4, Red Flag Number 4, New Back Pain Over 50. As we age, our bodies change, and unfortunately that includes an increased risk of certain health problems. If you're over 50 and suddenly develop new back pain, it's essential to take it seriously. In this age group, back pain is more likely to be caused by age-related conditions such as spinal stenosis, degenerative disc disease, or even osteoporosis, which weakens the bones and makes them more susceptible to fractures. Another concern for people over 50 is the possibility of cancer. While back pain is a very common symptom, it can sometimes be a sign of certain types of cancer, especially if it's persistent and doesn't improve with rest. Now, this next red flag might seem unrelated to back pain, but trust me, it's an important connection. If you're experiencing unexplained and unintentional weight loss along with your back pain, it's crucial to seek medical attention. Unexplained weight loss can be a symptom of a variety of health problems, some of which could be causing your back pain as well. One possibility is cancer. As cancer cells grow and multiply, they require a lot of energy, which can lead to weight loss. Additionally, certain infections or inflammatory conditions that can cause back pain may also lead to weight loss. Now, some degree of stiffness, especially in the morning, is normal. But we're talking about severe stiffness that makes it difficult to move your spine, bend over, or even get out of bed. This level of stiffness can be a sign of ankylosing spondylitis, a type of inflammatory arthritis that primarily affects the spine. Over time, ankylosing spondylitis can cause the bones in the spine to fuse together, leading to stiffness and reduced mobility. If you're experiencing severe spine stiffness, especially if it's accompanied by other symptoms like pain and fatigue, it's important to see a doctor to get a proper diagnosis. The final red flag is the most concerning and requires immediate medical attention. If you experience any signs of nerve injury along with your back pain, it's crucial to seek emergency care. Nerves are like electrical wires that carry signals between your brain and the rest of your body. When these signals are disrupted, it can cause a variety of symptoms. In the case of back pain, nerve injury can manifest as numbness or tingling in your legs or feet, weakness in your legs, or even difficulty controlling your bladder or bowels. Nerve injury can occur due to a herniated disc, spinal stenosis, or a spinal injury. So there you have it, the 7 worrying signs that your back pain might be something more serious. Remember, these are just potential red flags, and experiencing one or more doesn't necessarily mean you have a serious condition. If you are experiencing any of these symptoms, consult with your healthcare provider. They can help determine the cause of your back pain and recommend the best treatment plan. Thanks for watching, and remember to consult with your doctor before starting any new exercise program.